All right, consumers already reeling under the impact of inflation are set to be hit by another tornado. Prices of essential medicines like painkillers, anti-infectives, cardiac drugs and antibiotics are slated to possibly go up from next month. That's from the 1st of April. The government has allowed drug manufacturers to adjust their prices in line with the wholesale inflation index. The wholesale price index was reported around 12% in 2022. Hence, it's being assumed that the prices of essential medicines are set to increase by nearly 12%, barring an intervention from the ministry. And though the advocates of the pharma industry argue that it's much needed as prices of imported raw materials have gone up drastically, increasing the prices of these essential medicines will hit consumers hard, whose only option will be to swallow the bitter pill. We're going to be speaking now with Raja Bhanu, Secretary General, All India Drugs Control Officers Confederation. Bejon Mishra Founder, Patient Safety and Access, will be with me on the show, as well as Srinivasan, Managing Trustee of the All India Drug Action Network. But before we get to that discussion, let me listen in to a short report by my colleague Lisa, who's explaining why this is happening.
Well, the prices of essential medicines, the likes of painkillers, anti-infectives, cardiac drugs and antibiotics, that is slated to go up from April 1st onwards. The government is likely to allow the drug companies to increase the prices of the drugs in line with the WPI print. If we look way back in 2022, the annual change in WPI, that works to around 12.12%. So the prices of around 384 molecules, which corresponds to around 900 formulations spread across 27 categories, that is expected to go up by around 12%. So, well, this is the second year in the row where the increase is more than that allowed for non-scheduled drugs. Well, the non-scheduled drugs are which are outside the price control, and they have been allowed a price increase of around 10% per year. And if we look at the recent price hikes, like last 2 years, in 2021, the drug price regulator, they revised the ceiling price of widely used drugs that was based on 10.7% WPI print, while in April 2022, the prices of over 800 drugs under the NLEM, that is National List of Essential Medicines, which included essential drugs like paracetamol, even COVID, medications for hypertension, diabetes, that increased by 10.7%. So, well, this looks like good news for pharma companies. However, for consumers who are already reeling under the pressure of inflation, for them it's a sort of bad news.
All right, so are your medicines going to become more expensive from the 1st of April? Is there any way around this? What are the options for consumers and for the industry? To speak more on this, I'm joined now by Raja Bhanu of AIDCOC and Bejon Mishra of Patient Safety and Access. He's a consumer rights activist. I will also be speaking with Srinivasan of the All India Drug Action Network. So welcome to all of you. Mr. Bhanu, let me begin, with your take on what is the impact this will have. I believe that out of all of the sales which take place, this will impact about 20% of the labels out there or the brands out there, and we'll see a hike in those 20%.
Yeah, good evening, Tamanna. Good evening to the panelists over here and also to the members who are looking at it. Let me be very clear from our organizations what we are talking right from the beginning, that in our country we know that the out-of-pocket spending will be very high, and definitely this will also impact, this particular pricing hike will also impact them also. And we have been advising that these are the things which has to be kept in mind, and especially which will hit the poorest of the poor. And you know that the drug is a very vital component in the healthcare system, and the price hike will definitely definitely cost them more. And as you have already suggested that 12.12% hike will be there because of the WPI, which is not so in the especially for the last couple of years and more than a couple of years. And as I said that the scheduled drugs which are to be more with respect to this WPI will be hit by this one. As you already told that around 384 molecules, around 900 formulations will be hit. and definitely it is going to cost the patients. And our policy, as a policy, we expect that it should be patient centric, and more so after post pandemic, where everything is really hitting the patients very hard. Yeah.
Now, I want to understand from you, Bejon Mishra, what are the options that consumers have? You know, the argument could be that there are generic medication in, which are out there for people. So, do consumers have options, or is it really going to hit hard?
Well, consumers are always victims of such policies. You see, it's going to hit hard because, as it is, we are reeling under high inflationary pressure on us in terms of our daily budget. The options, you asked a very good question, Tamanna, that is, what are the options? The option is, you see, government had started a scheme called Jan Aushadhi, where they were able to make accessibility and affordability in terms of essential medicines to be sold under the brand of Jan Aushadhi throughout the country. I'm wondering what is happening to these 1.5 lakhs outlets, which are supposed to manage the pricing mechanism, number one. Number two, universal health coverage. All the health and wellness centers in the country are deemed to be providing free medicines to the citizens in the primary health centers, which is the health and wellness centers. I'm again wondering, where is this sourcing happening? How is it happening? Why can't there be competition? Because what I can see and I can feel is that the government always goes for L1, which is the lowest medicine pricing. And then they are not bothered about the quality, and the medical practitioners are very scared to prescribe such medicines to the patients because they are not sure about the outcomes. So there is a great need for the regulator to understand it's not only the 12% increase they're talking about. They should talk about quality, safety, accessibility, affordability, which is the mandate of NPPA. And where is this consultation? They have to come out in a very transparent manner. They have to consult all the stakeholders before they talk about a price increase. We all, have the right to know how you're giving this increase, in what manner you're giving this increase. You see, just because the industry tells you that I'm getting into a loss, do we listen to that? Or we actually figure out what the regulator is trying to do in terms of making a transparent policy, which will help us to understand, yes, they deem to get 12% or 10% or 8%. And then the people who are overcharging, all that money which has got collected, it is going to the consolidated fund. Why are those overcharged money which is getting collected within the government not used for the poor to ensure that they are able to access?
Now we're conflating issues. 1 minute, we're conflating issues. One is we're talking
you're talking about solutions, Tamanna.
Right. I'll come to you on that. We're talking about a certain category of drugs whose prices will go up. Are there alternatives of similar quality available at lower prices for people? That's question number one. Mr. Srinivasan, the second aspect of this is the pharma industry that has been saying that our costs have gone up. The costs of APIs went up post-pandemic. We remember the whole scare about, shortage of APIs, etc., which we imported from China, supply chain blocks. Do you think it's legitimate to have perhaps a double-digit hike from 1st of April in certain categories?
I think we are indeed not only conflating the issue, but confusing the issue, because this move is as per the drug price control order. And this takes place every year. The DPCO 2013, which is a part of the Essential Commodities Act, it says that every April 1st, the ceiling prices of essential drug medicines which have been fixed will be increased as per the WPI. So there's no question of government is conspiring or anything. I'm not a supporter of government at all. And now the question to be asked is WPI the right indicator for talking about the increase in prices of medicines? It is not. But that's a different issue. But as far as this move is concerned, it is done as per the law. And probably the government did not have any other, unless you abolish the DPCO 2013 and think about the issue afresh. every April 1st, medicine price increase of essential medicines, the 384 medicines you were talking about, will happen inevitable. And whether you want to have a sort of lessen the burden on the healthcare, on the consumers, that's a totally different issue. And that we have to look at the health systems in total.
To understand this, you talked about pegging the increase, the annual increase to the WPI. The WPI in the month of February was sub 4%. You know, it was about 3.5% odd. Now we have to see what the figure will be. It was actually 3.85% to be precise. We have to see what the figure will be for the year 2023. We're pegging this to 2022, which was in a sense an anomaly statistically, based on the base rates and COVID impact still going going through all of that data. So first of all, should we peg it to WPI? Number one, should you peg it to WPI 2022, which is not a normal year in terms of inflation for India or the globe and has the base rate effect through it statistically? Mr. Srinivasan.
No, I think the question of should it be pegged to the WPI is it should not be pegged, because the WPI is not a proper indicator for the price increase of medicine. It is a bundled aggregate of weighted average of several commodities, more than 300, 400 commodities in different categories. And each commodity, the prices behave in different ways. So how can you have an aggregated bundled commodity indicator as a price index of medicine? It is absurd. So we need to formulate a separate drug price index and then talk about price increase, etc., etc. But that said, I'm the last supporter of industry, but prices of raw materials do increase. Prices of APIs do increase from China or not from China, and therefore we have to account for it. We have to be reasonable. And so the methodology of calculating the ceiling price is totally problematic, which we have talked about in several other fora. But that we will not get into it now. The methodology of ceiling price calculation is totally absurd. It is on simple average pricing instead of cost plus pricing. So there are so many anomalies. But coming back to this issue, what the government has done, you can only question on whether the WPO was calculated properly. But I am not an expert in the commodities. I don't know what data the government had. And if they say it is on 12%, at present we have to, tentatively, we have to accept that 12% is correct.
The question is, should the government intervene? Raja, Bhanu, let me come to this. If we are saying that it is pegged to WPI, the NPPA has said that 2022, 12% is what we're going with, which is why we're expecting this, higher sort of increase from the 1st of April. Is there scope of government intervention or requirement of government intervention here?
You see, I think already the Jan Aushadhi Kendras, which are with PM BJP and all, which have been across the country, what Bejon said, and also Srinivasan also said about these things and all. If you can see those things and all, if I can give you a couple of examples in this one. You are talking about the prices which are expected to rise in terms of in the category of antibiotics and all. You see the amoxicillin 500 and potassium clavulate, that 500 and 120 or 625, that what we call. The Jan Aushadhi Kendras, you get it at 56 rupees. Whereas that the famous brand, I don't want to give the brand name, it costs about MRP 109. But whereas the landing cost to the wholesale price is around 70, it is almost nearer to the MRP of what is Jan Aushadhi Kendras. So that means there is a possibility of that kind of a price can be arrived at. But only thing is we are going with this kind of a thing and all, and that WPI and all, every year on year, and all those things. As Srinivasan said that.
Yes,
yeah, please.
So just give us some perspective, just the point which, Bejon Mishra had also raised. How many Jan Aushadhi Kendras are there? Are they accessible in number to people? If you have to, because, finding a pharmacy close to where you live or even online is very, very easy. So is the consumer or the patient going to have to go the extra mile to find a Jan Aushadhi Kendra? Is this going to be the drug or the kind of medication or the brand that your doctor is going to recommend? Because the Indian patient will go by what the doctor says. All of those are big loopholes in that whole process, isn't it?
Is the question to me?
Yes, yes, Mr. Bhanu.
Yeah, I think if you can see the models which has, I mean, countrywide, and when it started as a Janaushadhi, this has been a model which has been there for, and in different names and all. Even in Andhra Pradesh, also different kind of a thing. It has with the Jeevan Dhara and all. This has been replicated in various districts and all. I think so is the case with other across the country also. Only thing, the numbers what you are talking about, and once this model is as a government itself is promoting in this. Recently, we have celebrated Janaushadhi Divas, and slowly when it picks up and all, naturally the availability, accessibility, and affordability will be near to the consumer only.
Will be. The question is it...
You may be talking about the basket of drugs and all.
Is it right now? No, Bejon Mishra, it will be, hopefully at some point. Is it right now? Is it easily accessible and available? Let's, cut through the jargon. Specifically, he talked about an antibiotic. Is that available for 56 rupees instead of 109 easily, or is it difficult to access it at that cheap price?
Trying to explain, Tamanna, choice is the biggest weapon for a consumer. The consumer must be able to make a choice and improve the accessibility and affordability of medicines in the country. We had done a lot of experiments on this. We are still experimenting. But the price increase is going on year after year, and the laws can be changed. The lawmakers can bring a change in the policies and the laws. So we can't keep saying that because the law is there, we can't do this or we can't do that. We have to change the law if it needs to be changed, because these are all outdated laws now. How do we bring in a law which will encourage competition, which will encourage quality, safety, accessibility, affordability, for which NPPA has been institutionalized? That is the mandate given to NPPA. Have they done any impact study on the existing Janaushadhi stores? Are medicines available? People are talking about medicines, but are they made available? This is what we want to know, at the price which they can afford. The government sourcing. How is the government sourcing happening? We have to understand that and bring in a fair competition at the marketplace to bring that choice to the consumer. Where is it? Tamanna, I want to understand that. It's not only 12% increase we are talking about. It is talking about accessibility and affordability of medicines in our country.
On the website of janaushadhi.gov.in, it's very clear that more than 8,604 are currently functional. This is across the country. So clearly this can't be the only option for people who are looking for cheaper versions. But it's not just about cheaper versions. Mr. Srinivasan, I think you made the point that we have to keep in mind the pharma industry as well, who has gone through a tough time. They are facing questions of quality. There is news today of some companies being held up because of quality issues. So do you think that those margins are now required to ensure that the quality is kept up?
No, that's a little complicated question. According to me, I belong to an organization which manufactures medicines at low prices. I don't think high prices are justified in the market, and a good quality medicines can be made at reasonably lower prices. But low is not low enough. It has to be affordable to the masses of this country. So we are asking the wrong question. We should not be asking about, well, we should be asking in a sense that we should be worrying about high cost of medicine, how it can be lowered. But the larger question is, how can we make healthcare accessible and free of cost to everybody in this country, as it happens in England and Scandinavian countries and even in Canada? But we have copied the American model, in which if you get sick, you're done for. We should copy the Canadian model, we should copy the English model, British model, and the Scandinavian model. And that is the question we need to ask.
No, so we want to, increase or expand the scope. The question is, what is going to happen right now from the 1st of April? We'll have to wait and watch whether there is an intervention, to what extent those prices are really hiked and how much it impacts you. I think the missing link in that chain is the doctors, the medical representatives or the doctors who actually prescribe specific brands of drugs and that creates the supply and demand equation for patients as well. Thank you so much to all of you for joining us on the first part of this discussion. But staying with the pharma sector, in a massive crackdown on manufacturers of spurious medicines, licenses of 18 pharma companies have been cancelled. This comes after the DGCI carried out inspection of over 70 companies under the joint operation carried out by state and central government. My colleague Samir brings this exclusive report.
In a strict drive against the manufacturing of fake drugs or the substandard quality of drugs, the centre has taken action against 76 pharma companies. What we are getting to know from our health ministry sources that a joint operation was conducted by the centre as well as state government officials. The DGCI carried out inspection in 20 states across the country and 203 pharma companies were identified. The government has been constantly receiving complaints regarding the fake drugs, or there has been substantial quantity of drugs which is substandard quality that is there in the market, and this drive was carried out, and out of the 203 pharma companies which were identified, the action has been taken against 76 pharma companies. But we are getting to know that 18 firms, their license has been cancelled or the manufacturing has been asked to stop immediately. So their manufacturing license has been cancelled by the government. In addition to this, the 3 firms, their product permission has been cancelled by the government. Also, the show cause notice has been served to 26 pharma companies. The sources have informed that this is just the first phase of the special drive against the fake drugs, but this drive will be continuing. More such phases will be there, and it is very likely that more action will be taken against the pharma companies, those who are indulged in the manufacturing of fake drugs.